Hello, everyone, and welcome to episode 6 of Discover Dental Science. Thank you for all of you for joining me, and thank you for those of you that have been along for all 6 episodes. Really appreciate it. It's been a lot of fun for me, and this will be our last one in the series, and we decided to do something a little bit different. Today's going to be a little discussion about the career of dentistry or the profession of dentistry. So it's a little vocational talk for those of you that might be interested in the field of dentistry or just kind of want to know a little bit more about it. That's what we're going to talk about today. The first question I often get when I'm talking to young people that are in career fairs or interested in the profession is what kind of school is required, all right? So to answer that question, after high school, you would go on to a 4-year university to get your undergraduate degree. Sometimes it takes more than 4 years to complete that, 5 or 6 years, depends on the school and the situation. And then after university, an undergraduate university course of study, then you would apply and go on to dental school, which is usually 4 years in addition. The first 2 years of dental school, you're doing a little bit more didactic book work. And then the last 2 years, you're doing more clinical work. And you're usually in that clinic, and there's professors and teachers there observing your work and answering questions and doing all of that. Dental school, although very difficult, is a lot of fun. I mean, it's very challenging, but it's also, you're actually kind of studying what you're very interested in. And anytime you study something that you are interested in or you like, you tend to do well and you tend to enjoy it a lot more. So I found dental school, even though it was, like I said, difficult, there's a lot of exams, a lot of testing that goes on, a lot of book work even in the last 2 years, I still found it a great experience. After 4 years of dental school, and you take a license by the state, you're then licensed to practice dentistry. And you would be considered general dentistry. It's exactly the same. Some general dentists will call themselves a restorative dentist or a cosmetic dentist or a family dentist, all the same. And sometimes general dentists will tend to kind of focus on certain areas like cosmetic dentistry or treating families, but those general dentists have done 4 years of dental school. And you can go out and do private practice. You can set up your own business. You don't necessarily have to set up your own business. You could go work for somebody else that owns the business. You could go to work for a clinic, such as a community clinic that treats people that don't have access to a private practice dentist. You could go on and work as a teacher, so you can go back to the dental school and teach dentistry. Quite often, instructors or professors in dental schools do both. They may work in a private practice for a couple days, and then they may teach at the school for 2 or 3 days. And so quite often, professors at dental schools, they practice privately as well as teach. Or you could not practice at all. You could take your dental degree and you can go work for a company. You can do research and development. You can do scientific research at a university. You can do consulting. So there's lots of things you can do with a dental degree that doesn't necessarily mean treating patients. lots of options. But let's say during your course of study in dental school, there's a particular subject that really interests you and you want to go on and specialize. Usually that is 2 years more of study, sometimes 3, even sometimes 4, if you go on to do it like a PhD. And there's several recognized dental specialties. The first one that comes to mind is endodontics. You think endo, you think inside, and indeed, a endodontist specializes in the root, or what's inside the root of a tooth. So if you come up a little closer, I can kind of give you just a real quick idea of what a root canal is. Let's say the decay in a tooth got in so far in that it actually infected the inside of a tooth. Now, we would hate for that infection to go untreated because eventually the tooth would be lost and the patient would have a lot of pain. So what a endodontist does, and it's a very skilled procedure, they go in and they clean out all that necrotic tissue, all that dead stuff and infection inside there, and they clean that out. They make it as clean as they possibly can, and then they pack it with material so that it doesn't get reinfected. Okay, and it's a very delicate, precise procedure, and usually what happens is after that the tooth heals up and it gets restored, and the patient can continue to have that tooth for many, many, many years, hopefully the rest of their life. Okay, so it's a wonderful service. Endodontists are heroes in many cases in that they save teeth that would otherwise be extracted. And quite often you think this procedure might be very uncomfortable, and most people experience kind of the opposite. They're in pain, and so when they go to the endodontist, they take care of that pain, and they're like, oh my goodness, that was a great experience. So now, because I don't have any pain anymore. So quite often people say, oh, I don't want to have a root canal, but then when they have it, they're like, oh my God, thank you, I feel so much better. So that's what a periodontist does. Excuse me, an endodontist does. And I'm going to go to the periodontist next. A periodontist is a specialist that quite often does surgery, but it has to do with what's on the outside of the teeth, what is supporting the teeth, also called the periodontium, okay, which is the bone and the gum tissue around the tooth. All right, so I'm going to go click on periodontist, and what gum disease is if somebody's not brushing or flossing, they get material that gets stuck to the tooth. This is that calculus or tartar that we talked about several episodes ago. And if those offending organisms are there, the body creates a response to that called inflammation, that you'll get the red gingivitis, the tissue, and pretty soon the body kind of backs away from that offending stuff, and it causes breakdown of the periodontium. So the gum tissue and the bone get diseased and break down, and if it's left untreated, then eventually that tooth could be lost. So hopefully before that happens, a periodontist, again, super skilled individuals, very delicate surgery, can kind of lift the gum tissue away, get rid of all that offending stuff that's causing the inflammation, create a very smooth, clean surface on the tooth called scaling and root planing. Quite often they'll do what's called a bone graft. They'll actually add material to work as bone to support the tooth, and then they very delicately put the gum tissue back and suture it into place, and hopefully it heals. And that tooth, again, is saved for many, many years, hopefully the rest of the patient's life. Okay? So again, periodontists are quite often heroes too, whereas normally a tooth would be extracted and lost, and then you would need an implant or a bridge. Quite often a periodontist can save that tooth, or at least give it many, many more years of service in that patient's mouth. So that's a periodontist. The next dental specialty I'll talk about is an oral surgeon. Oral surgeons are it's a great specialty. They're in an operating room or an operating type setting, and they're involved with tooth extractions, like wisdom teeth, quite often, but a lot of other things. Some oral surgeons are involved with surgeries of the jaw. We talked about that a few episodes ago as well, that sometimes the jaws aren't lined up and we need to reposition those jaws. An oral surgeon is quite often involved in trauma, where if a kid takes a dump on a bike or has a sports injury, or more serious like car accidents and things that happen, if there's damage to facial structures, it's the oral surgeon that usually takes care of that patient in a operating room setting. And they do some remarkable things nowadays to help patients in that matter. Oral surgeons and periodontists too are involved quite often with putting implants in, okay? And so if a tooth is missing or lost, quite often the oral surgeon or the periodontist involved is in putting in the implant with the general dentist. It's usually a team approach that happens with implants. So again, that's the oral surgeon. The next specialty, and there's not very many of these around, but it's a really cool specialty. It's dental radiology. So a dental radiologist, much like a medical radiologist, looks at x-rays all day long. They look at x-rays, and sometimes we see things in private practice that is very unusual, or we can't really decide what it is, and we want to make sure that it's not a serious pathology or a disease. So we will refer these x-rays to a dental radiologist, somebody that has some more experience and education on reading x-rays, and they will give us a diagnosis or some input on what they think it is. And what's cool nowadays is with the 3D imaging that we talked about in a previous episode, and being able to electronically and privately share these x-rays through the internet makes this service really great nowadays. So that is a dental radiologist. The next specialty we'll talk about is a pediatric dentist. Pedo, kids. Pediatric dentist, it's such a cool specialty. It takes a very special person, I think, to work with kids. Can be very, very challenging, okay? Because a lot of times you're dealing with like 3-year-olds and 4-year-olds, and if any of you have siblings, sometimes they don't always behave the way you want them to behave, right? So a pediatric dentist quite often they're very skilled, and the people that work with pediatric dentists are very skilled at making children feel comfortable, educating them, and at the same time needing to get in their mouth and take care of sometimes some pretty serious infections. So, and sometimes it's the mom that needs as much of the treatment as the kids. But the pediatric dentist is involved in treating children and what all their special needs are. Quite often, speaking of special needs, if there are special needs young people, it's the pediatric dentist that is best equipped to handle patients that have special needs. Yes, the pediatric dentist can be, like I said, a very challenging day, but also kids say the darndest things. They can be so fun. And that's the aspect of a pediatric dentist. I think that they enjoy their job so much. You could have just three or four, just 5 patients in a row, and they're just challenging and difficult. But then a kid will say something to you, and it's like it makes you laugh, and you just, it turns your whole attitude around, and it's great. Working with kids is great. Which brings us to the last specialty that I know very well, and that's orthodontics. I think it's the very best dental specialty out there for so many reasons. One is I do get to work with kids, okay? Where I don't usually work with little kids unless they have serious birth defects. So usually I don't start seeing kids till about 7 or 8 years old. Okay, that's usually when an orthodontist should see a kid and evaluate them and evaluate their dentition and how their teeth and jaws are developing. But we don't really always need treatment at that age. Some do. Kids that are super crowded or have crossbites or jaw growth issues, or their teeth are impinging on their palate, quite often early treatment is needed. But normally we wait till the permanent teeth are in. And like we talked about in episode 2, I think, when those permanent teeth are arriving and the young person's jaw is still growing, that's when an orthodontic wants to get involved. Usually 11, 12, 13, right in that age. So predominantly my practice is teenagers, okay, in that range. And probably about, I'd say about 40% of my patients are teenagers that are a blast to work with as well. Okay, everyone is so different, all the personalities, what's going on in their life with their sports and their activities and the music and popular culture and their education, and there's just so much going on in a teenager's life, and I get to be a little bit a part of that. And it's awesome too, because I usually get to see the youngsters or the teenagers a little bit more frequently, whereas the general dentist or the pediatric dentist usually going to see them about every 6 months, whereas I get to see them about every other month. Okay, sometimes more, sometimes less, but usually it's about every other month. So I kind of get to know my patients a little bit better during that time, and I enjoy that, and it's very rewarding. And what's kind of fun too is usually right behind them there's another sibling, right? There's a little brother or sister coming in with them, so I kind of get to know them a little bit before they start treatment, and they get to know me and my team, and it makes the office a lot of fun because we kind of get to know families as kids are growing up and coming through orthodontic treatment. Super rewarding. But I also get to treat adults, which is awesome too. It's quite often more challenging because, remember, we don't have growth happening in the adult jaws, and sometimes it's hard to get the bite corrected. That's what makes it more difficult, because there's not as much growth. Sometimes they have teeth that are worn down because they've had them a lot longer, and it makes it more difficult to get them to fit together. Or sometimes they have natural teeth, some of them have fillings, some might have a crown, there might be some periodontal disease going on. So the adult orthodontic patient quite often has concerns and issues that the teenager or the youngster don't have. And that makes it a challenge for me as well. So what I love about ortho is every patient is so unique in what they present with and what they, the artistic part of it, of what their smile is supposed to look like and how they smile and where the teeth are best positioned in that smile to give the best aesthetic result. But also I have to make sure that functionally the teeth fit together right and the jaws function right. And remember, the TMJ functions right. So there's a lot that goes into that ortho patient than just delivering braces or giving them aligners. There's a lot more that goes into it. And I find that very challenging and very, very rewarding. So I love orthodontics. I could talk about it all day. But those of you that have been into the office, you can tell, I hope, that you see that not only do I enjoy what I do, but also my team members as well. Orthodontic offices have a certain unique energy and culture that is a lot of fun. Speaking of which, let's talk about the team, because I want to talk to you, especially young people that are considering different careers. If going on to dental school or dental specialty, because you have to enjoy school, right? Because you've gone through not only high school, at least 4 years of college, 4 years of dental school, so 8 years to be a general dentist. But then if you want to specialize, it's going to be 2, 3, or 4 more. So you're looking at 10, 12, 13 years of school beyond high school. So you got to really enjoy school. And I did. I loved school. And when it was over, I kind of missed it. But if you don't necessarily want to be a dentist, you could become a hygienist. Just wonderful people that are involved in educating patients about oral hygiene and doing a lot of the treatment, cleaning, scaling, root planing, such that the dentist can devote more time to restorative procedures in the office. So the hygienist is a very important person of the team. Equally important is an assistant, usually called an RDA, a registered dental assistant. Registered, they've gone through some extra training and taking a test, much like a registered nurse. This is a registered dental assistant. You can be a dental assistant and not be an RDA, but most of the assistants you see working in offices are registered dental assistants, and they're involved with assisting the dentist and the hygienist, and very important, very difficult to work by yourself on a patient, especially on certain procedures. You need that extra set of hands, and quite often the dentist is focused on the procedure, but the RDA is kind of paying attention to everything else and anticipating what the dentist is going to need next. RDAs are very, very valuable. And in ortho, even more so, because they're allowed to kind of do more of the hands-on adjustment with braces and aligners and education that happens in the orthodontic office. So that is an assistant. You could also become a lab tech. Yes, there's a registered dental technician that you go on and do. It's 1 to 2 years of school, and you can learn how to make crowns. You work with porcelain, you work with metals and other materials that are involved with restoring the mouth. And very, very important job. You can have a very skilled dentist, but if the lab doesn't do a nice restoration and it doesn't look good, patient's not happy and they think it's the dentist's fault. Well, no, they have to use a really good lab and a very skilled lab technician to give a very natural looking restoration if a tooth is broken and needs to be fixed. In orthodontics, I have a lab technician, Rob, here in my office. He makes retainers and makes other appliances, orthodontic appliances like expanders and such, that I deliver to patients' mouth. And it's really nice to have a dental technician in your office, because we can turn things around really quick, and if something's not right, we can adjust it very quickly and the patient doesn't have to come back for another visit. So it's great having Rob in the office. So if you are very artistic and you have the patience to take your time to do things delicately and precisely, and you like that artistic part of it, then perhaps a dental technician is a career worth considering. And also, there's all the administrative duties that happen in an office. For example, there's office managers that deal with a lot of the human resources stuff that goes on and managing an office. Treatment coordinators, especially in orthodontic offices. Quite often the treatment coordinator is the one that welcomes patients into the office for their initial visit, educates them on orthodontics and what treatment how it would benefit them, and kind of works with the orthodontist in answering that patient's questions and getting them signed up for treatment. That's a treatment coordinator. There's also like a financial coordinator. Quite often financial coordinators are also involved with insurance. So if you like to work with money and help patients and parents figure out the payments and how to pay for treatment, financial coordinators do that. There is also scheduling coordinators, very important. Usually the front line of the office, they're the first person you see when you walk in the office. They're the patients, or the people that when patients call, they're the ones picking up the phones. Very challenging job. I often say it's probably one of the most difficult jobs in the office, because you have to do like 4 things at once. You're answering phones, you're talking to somebody, you're entering in a chart, you're talking to a team member, and you got to be able to do 4 or 5 things at once. Amazing people. It takes a certain upbeat, positive person that is a very welcoming and friendly nature to them to be a scheduling coordinator and work up at the front desk. And hopefully you get a sense that it's a team, all right? And being part of a team, whether you're the dentist, the hygienist, the scheduling coordinator, office manager, financial coordinator, everybody's got to work together. And that in itself is very rewarding and something that's a lot of fun and doesn't happen in all careers. So that's why I want to talk to you about dentistry and the careers of dentistry, because it's not just about working in a patient's mouth. There's lots of other careers. I have just so much fun with my team here, and I know a lot of other offices are like this as well. That when you all work together and the patients are happy when they come in, they're happy being there, and they're happy when they leave, hopefully happier. It's very, very rewarding. At the end of the day, we're high-fiving each other and wishing each other a good evening, and we can't wait to see them again tomorrow. And it's just a great workplace and a great place to be a part of. So something I'm very proud of here at Marcella Orthodontics. And if you have any other questions about a career in dentistry, and you want to talk to me more about it, please do so. When this COVID thing goes away, and if you want to have me come talk to your group, I'll be happy to do that as well. But certainly call us or text us with any questions, and would be happy to answer them for you. Once again, I want to thank all of you for joining me today and in the previous episodes of Discover Dental Science. It's been a lot of fun for me to do during this time. My Tuesday mornings, I always look forward to it. And thank you. And I am going to go back to working on my charts and working on my orthodontics, working on my business. You guys all stay safe out there, and we look forward to seeing you real soon. Take care. See you later.